Welcome. Today we're diving deep into the world of urinary health, focusing on a common yet often uncomfortable condition: cystitis. Cystitis, simply put, is an inflammation of the bladder, most often caused by a bacterial infection. But there's more to it than just that. Join us as we explore its causes, symptoms, treatments, and ways to prevent this bothersome ailment. So, what triggers this inflammation? The most frequent culprit is a bacterial infection, specifically Escherichia coli, or E. coli, which normally resides in the bowel. These bacteria can enter the urethra and travel up into the bladder, leading to infection. However, cystitis can also arise from non-infectious causes. These may include certain medications, radiation therapy, irritating hygiene products, or even long-term use of a catheter. In rare cases, it might be a complication of another underlying medical condition. Let's delve into the pathophysiology. When bacteria enter the bladder, they adhere to the bladder wall and begin to multiply. This triggers an inflammatory response. The bladder lining becomes irritated and swollen, leading to the characteristic symptoms of cystitis. The inflammatory response involves the release of various chemical mediators, further contributing to the discomfort. In non-infectious cystitis, the irritant damages the bladder lining directly, initiating a similar inflammatory cascade. Cystitis is a widespread condition, particularly affecting women. This is due to a shorter urethra, making it easier for bacteria to reach the bladder. While cystitis is more common in women, men can also be affected, especially as they age. Certain risk factors like sexual activity, use of spermicides, pregnancy, and menopause further increase the likelihood of developing cystitis in women. In men, an enlarged prostate can contribute to urinary retention, which raises the risk of bacterial infections. Recognizing the signs and symptoms is crucial for timely intervention. The hallmark symptoms of cystitis include a persistent urge to urinate, even when the bladder is nearly empty. This is often accompanied by a burning sensation during urination, known as dysuria. Other symptoms may include frequent urination, passing small amounts of urine at a time, cloudy or strong-smelling urine, pelvic discomfort, and blood in the urine, called hematuria. In some cases, a low-grade fever may also be present. It's important to note that children may present with different symptoms, such as bedwetting or irritability. Diagnosing cystitis typically involves a review of the patient's medical history and symptoms. A urine sample is usually collected and analyzed, looking for the presence of bacteria, white blood cells, and red blood cells. This is known as a urinalysis. In some cases, a urine culture may be performed to identify the specific type of bacteria causing the infection and determine the most effective antibiotic. For recurrent or complicated cases, further investigations such as cystoscopy, which involves inserting a thin tube with a camera into the bladder, or imaging studies like ultrasound or CT scans, may be necessary to rule out underlying structural abnormalities or other conditions. Cystitis can be categorized into several types. The most common is acute cystitis, usually caused by a bacterial infection. Recurrent cystitis is defined as multiple episodes of cystitis within a certain time frame, often requiring further investigation. Interstitial cystitis, also known as painful bladder syndrome, is a chronic condition characterized by bladder pain and urinary frequency and urgency, but without evidence of a bacterial infection. Other types include radiation cystitis, caused by radiation therapy to the pelvic area, and drug-induced cystitis, triggered by certain medications. Treatment for cystitis depends on the underlying cause. For bacterial cystitis, antibiotics are the primary treatment. The specific antibiotic and duration of treatment will depend on the type of bacteria identified and the severity of the infection. Over-the-counter pain relievers can help alleviate discomfort. Drinking plenty of fluids is also crucial to help flush out the bacteria. For non-infectious cystitis, treatment focuses on managing the symptoms and addressing the underlying cause. This may involve avoiding irritants, taking medications to relieve bladder pain and inflammation, or undergoing specific therapies. Preventing cystitis involves several lifestyle modifications. Drinking plenty of water throughout the day helps flush out bacteria from the urinary tract. Urinating frequently and emptying the bladder completely can also help prevent infections. Wiping from front to back after using the toilet is essential to prevent bacteria from entering the urethra. Avoiding irritating hygiene products, such as douches and scented soaps, can also help. Some women find that urinating after sexual activity can reduce the risk of infection. In some cases, prophylactic antibiotics or cranberry products may be recommended for individuals with recurrent cystitis, but these should be discussed with a healthcare provider. The prognosis for cystitis is generally excellent, especially when treated promptly with antibiotics. However, recurrent cystitis can be challenging to manage and may require a more comprehensive approach. Recent research is focusing on developing new and more effective antibiotics to combat antibiotic-resistant bacteria. Researchers are also exploring alternative therapies for interstitial cystitis, such as bladder installations and neuromodulation. Furthermore, there's growing interest in the role of the gut microbiome in urinary health and how modifying the gut flora could potentially prevent recurrent cystitis. As our understanding of cystitis continues to evolve, we can expect even more effective treatment and prevention strategies in the future.